Hello, my name is Christiani, and welcome to episode 1 of Address the Disconnect. As I mentioned in my previous video, this series is going to take a look at the many branches of systemic racism and the history that has produced them. The first branch is healthcare. The first healthcare system afforded to African Americans was called the slave health system. In the 17th and 18th centuries, the goal of plantation owners was to keep their slaves healthy enough to perform labor, and therefore some were given the small luxury of seeing doctors for ailments. However, freed slaves in the North faced great discrimination in the few hospitals that existed at the time. Doctors performed home visits to those who could afford it, and because of education and job discrimination that occurred at the same time, doctors' home visits were not something freed slaves could afford. Naturally, disease and death plagued communities, and hospitals really did not open their doors to Black people until the government forced them to, only 57 years ago, with the passing of the Civil Rights Act of 1964. The 18th century also saw a rise of pseudoscience that provided a basis for slavery and discrimination to prevail. These myths were greatly endorsed by the most famous intellectuals of that time, most of them active participants in the transatlantic slave trade, and so fabricated theories on the differences between white and Black people to provide a false sense of relief from their guilty conscience. Third President Thomas Jefferson published the idea of a weak lung capacity in Black people that can only be corrected through exhaustive labor. Another theory called drapetomania was used to describe the mental illness slaves developed that would cause them to run away from their owners. The published treatment was to whip the devil out of them. Prejudice-infused studies persisted into the 20th century.
What the United States government did was shameful, and I am sorry.
The Tuskegee experiment that occurred from 1932 to 1972 in Macon County, Alabama. 600 poor Black men, predominantly sharecroppers, which are freed slaves that continued to work on plantations for small pay, agreed to participate in a study of syphilis under the guise that they would receive treatment for the disease. Instead, researchers wanted to track the disease's progression, and although they had the cure to stop it, they watched as the disease slowly either killed participants or left them severely impaired. Once the story broke in 1972, public outrage put an end to this horrific study. All this history helps explain why African Americans have such a difficulty in relying on the healthcare system, since the healthcare system was used so violently against them. This and more in my next episode. Remember, you can read more about this topic in the blog posted in the caption below.